So we're going to begin by laying on our backs, and I want you just to pay attention to where your back is on the floor. The majority of people, when they lay down, their lower back muscles naturally will touch the floor and their spine will remain in a neutral position. Sometimes people have very tight lower backs and they have a lot of space underneath their spine, and if that's the case, I do want you to tilt your hips back just enough so that your lower back muscles are touching the floor, but you're not pushing your spine into the floor. And then there can be some other people that have lost the curvature to their lower back, or their back is really, in this curled position. And so I want you to almost to tilt your hips down a little bit so you can relax that. So you feel your lower back muscles are touching, but your spine is not pushing into the floor, okay? And so an important piece is your rib cage stabilized? Do you have a connection with your rib cage and your pelvis? This is very, very important. So the easiest way for you to get your rib cage in the position that I want you to, or that's you're supposed to be, it seems so silly, but it works so well, is to go ha 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 ha. And so when you do that, without moving your back, keeping that back neutral, you feel this kind of, your rib cage is stabilized down with your abdominal muscles. And so now the third piece here is I want you to now, if you put your hand here, pull your belly button away from your hand. It's almost like a sandwiching between, this is my belly button, this is my spine. You're sandwiching that belly button in towards the spine without popping up the rib cage, okay? Often in the beginning when people are learning to do this, they suck their belly button in and it's, they pop up the rib cage, and I don't want you to do that. You want to keep the rib cage down and stable while you draw that belly button in. So, ha 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 ha. And, I've been doing this for so long that this naturally happens. It's just kind of one system. So I have a hard time now, breaking the two motions. But for when I work with my patients in the office, this is very important that we kind of take it step by step so that they can really feel what they're supposed to be doing. So in this position, just breathing, just the motion of your diaphragm moving up and down, you're going to feel it challenging to hold this position. So if that's the case, then that is an exercise you're going to start with. You're going to start by engaging this neutral spine, draw in, okay? And you're going to hold this, as long as you can while trying to breathe normally and naturally, okay?